Jones. I'm Dr. Church. Nice to meet you.
Hi.
This is Alan McGannon, our registry coordinator.
Nice to meet you.
And Megan Krasner, our genetic counselor. Have a seat, Mrs. Jones.
Thank you.
Well, Mrs. Jones, it was a great idea for you to come in today. I'm going to let Alan and Megan have a chat to you and find out what your family history is really like. And then we'll talk later. Okay?
Thank you very much.
All right, see you in a
Thank
little
you,
while.
Doctor.
Bye-bye. Good morning, Mr. Smith.
Hi, Dr. Church.
Well, it's been about 3 weeks since your colon surgery, hasn't it?
Yeah, I've been to work for 3 days and I feel great.
Well, that's great. Well, remember that tumor? We were going to do a Molgen profile on the cancer. It's good news. I've got the results here. The mutation pattern shows that your tumor is very unlikely to metastasize, so we won't be recommending any chemotherapy. You're going to do very well.
Oh, that's great, Doc.
Yeah, it is. And I've got something for you here. The Molgen profile does suggest that you're likely to develop more polyps and possibly another cancer in the future. So I'm going to recommend a VERT scope in a year, and then you should take these antiplas pills here, 1 a day.
Sure, I don't mind a bird scope. It's better than a colonoscopy. What's in the pills?
Well, there are different pills available for different genetic profiles. For yours, there'll be a COX-2 inhibitor and some calcium. Hi, Mrs. Brown. How are you today?
How do you do? Well, I'm a bit nervous, actually. I'm feeling well, but nervous about the results of the CHIPS.
Well, there's nothing to be nervous about. Let's get Megan in here and we can talk about it, okay? Megan, would you be able to come into room 302, please?
Hi, Mrs. Brown. It's good to see you again.
Nice to see you.
Giving that cheek sample wasn't so bad, was it?
No, it wasn't. What did it show?
Well, I have the results right here. The good news is that you have no cancer gene mutations. However, it does look as though you have one of the mutations associated with Crohn's disease. That means your uncle's colitis was probably Crohn's disease too.
Well, certainly not having cancer is good news, but I am a little concerned about the Crohn's gene.
Yeah, it does mean that you have about a 60% chance of developing Crohn's sometime in your life. I'd recommend colonoscopy and biopsy as a baseline because the mutation's the sort that's associated with Crohn's of the colon. I'd also recommend that you take a pill called anti-Crohn, which I'm just going to transmit a prescription to your pharmacy right now. You should be able to pick this up in about 10 minutes. Okay. There we go. Now I'm going to leave you here with Megan and she'll just have a chat to you about what this means for the rest of your family.
Okay.
All right, now talk
Thank
to you
you.
later.
Nice
Goodbye.
to see you.
Well, hi, Mrs. Jones. Hi, Alan. How are we getting on?
Hi, Dr. Church. Well, let me show you the family tree. Mrs. Jones has FAM risk factor 16.8, and I've been on the net and I've contacted 3 other hospitals for her path reports, and I don't think it's an FAP. I think it's H and PCC, and Megan and I have talked to Mrs. Jones, and she already signed our consent forms.
Well, Mrs. Jones, it's good that you came in today. It looks like you do have a high risk of getting colon cancer according to your family history. Fortunately, we can refine that risk.
How, doctor?
Well, first of all, I'd like you to get a chip scan, and also your dad and your brother should get one too. That should show us what mutation's operating in your family. Then we ought to get a mutacult test on your stool. That'll see if there's any polyps or cancers right now. If that's positive, we'll need to get a colonoscopy for you. Now, don't worry, I'm going to let Ellen set things up for you. She'll explain everything. And we'll see you when the results of the tests are available. Okay? Hi there, Mr. Green. Nice to see you.
Church. Thanks for fitting me in today.
Well, that's fine. I know you've been a bit worried by what we talked about on the phone.
Right.
We have the results of your scan here, and I'm afraid there are a couple of spots on either side of the liver.
That's pretty bad, isn't it?
Well, it's not so bad in your case. The Molgen profile in the tumor shows that the cells should really be susceptible to a couple of new agents that we have, tripobroden and expensolactan. If we start these now and then add in some precise rad, we should be able to take care of these tumors.
What are the chances of my tumors responding to this?
The chances are pretty good. The Molgen profile shows us that, but only about 30% of these tumors respond. Some don't respond at all. Some respond to other drugs. Then there's this new gene injection therapy that's just come out. It looks pretty promising. It's all in the genes, you know. Hi, Mrs. White. Ready for your colonoscopy?
Yes, but I forget why I need this and not a vert scope.
Remember, you had a Mutacult test of your stool as part of your physical. And the results of that suggest that you have a fairly large polyp in your colon. So that we need to be ready to take it out. That's why a vert scope isn't going to be useful here. We have to go straight to colonoscopy.
Okay, Dr. Church, let's get on with it.
Well, Mrs. White, it is a big polyp and we can't get it out through the colonoscope.
Does that mean I have to have an operation?
Not necessarily. I've taken several biopsies and we'll send them off and get a Mulgin profile on the polyp. Then that'll tell us if we need to do surgery, what sort of surgery we need to do, and maybe we can even avoid surgery altogether and treat it with medication.
Okay, Dr. Church. Isn't genetics wonderful?